A lot of us feel depressed when we first start out in recovery. We're clean and sober for the first time in a long time, and we finally see things clearly. We take a look around and we go, wow, I really screwed up. Look what a mess I've made of my life. It's pretty normal to feel depressed in this situation. So what's the difference between this normal kind of depression and a depressive disorder? A depressive disorder, the depression doesn't clear up. It hangs on or it gets worse. And it makes it really tough to concentrate on recovery issues. It's like we're walking around with a black cloud over our heads all the time.
Depression is a mood disorder in which depressed mood or sadness or an inability to experience pleasure are the prominent symptoms. Other symptoms common with depression include appetite disturbance, sleep disturbance, decreased energy, decreased concentration, inability to function in day-to-day activities in some cases, feelings of guilt, hopelessness, and worthlessness, and in some cases either suicidal thoughts or actually suicidal behaviors where a person actually attempts to take their own life. Depressive illness is extremely common. It affects about 8 to 10% of the population in the United States.
I thought it was bad enough being an addict. Finding out I had this second disorder, depression, seemed overwhelming. 2 disorders? Come on, give me a break.
When I quit using, I thought all the negative stuff would go away, but it didn't. In fact, it got worse. I could never stay clean for long. When they finally diagnosed this depressive disorder, I was actually kind of relieved. I mean, I finally knew what was wrong. And you have to know what's wrong before you can fix it.
Yep.
See, depression is a disease that affects the way we think. We call ourselves weak, we blame ourselves for not being happy, we feel like outcasts to the rest of the world. But depression is like diabetes or heart disease or any other medical problem. It's not our fault. But just like recovery from addiction, we are responsible to learn about the disorder and take actions to get it under control. So there are lots of different kinds of depression and lots of different kinds of treatments.
I have this kind of depression called dysthymia, and they explain it as a chronic low-level depression that lasts for 2 years or more. And what that means is you're always sort of down. Not suicidal or anything, but you're always down and sad, and you can never get your energy up and get your life in order.
Well, I've got recurrent bouts of severe depression. What that means is I'll be doing fine for a while, and then I get into these deep depressions where everything just seems overwhelming and I don't even want to get out of bed. But between those bouts of severe depression, I get along pretty good.
Another kind of depression is something called bipolar depression. That means when a person goes back and forth between periods of depression and periods of manic behavior. Manic means feeling really high or invincible or unusually energetic.
Yeah.
So there are lots of different types of depressive disorders.
Depressive illness, similar to other illnesses, you have different ranges of severity. You have some depressed people that can function, they can go to a job, take care of their families, take care of their responsibilities. You have some people on the other end of the continuum who are so depressed that they can hardly get out of bed, they can't get moving in the morning, they don't care if they live or die, they actually may make a suicide attempt, they're just not able to function, and the suffering is quite tremendous for these folks.
Depression is caused by a combination of things. What we believe, how we think, who we hang out with, what's going on at home, what we're eating, drinking, and sometimes what's going on with the chemicals in our brain. So when you talk about recovering from depression, you got to look at a lot of different parts of our lives.
Yeah. When they first told me that I was an addict, I denied it as long as I could. And then I accepted it, started to work the recovery program. Well, I stayed off the drugs and stuff, and I was doing pretty good, but I was still having a really hard time. I was still slipping into these deep depressions. That's when they told me I had a depressive disorder too, and I'd have to go in recovery for that. That was just too much, man. I didn't have the energy.
So what did you do?
Well, it kind of went in steps. First, they put me on an antidepressant medication. Now, I tried a couple of different ones, but they finally found one that worked, and it sort of took the edge off the depression. It gives you more energy so you can work on the other stuff. You know, my relationship with my family, what I wanted to change in my life, stuff like that.
So weren't you worried when they gave you an antidepressant? I mean, we're not supposed to take drugs when we're coming from an addiction.
Yeah, I know. I had a problem with that until I actually took the meds and realized they don't get you high. They tell me that when a person is severely depressed, the chemicals in your brain get out of balance. Now, these antidepressants actually put your brain chemistry back in balance, so you feel more like yourself, more stable, not so depressed. I've been high enough times in my life to know that antidepressants definitely don't get you high. They just make you feel more like yourself, so you can function, work on the other things, going to work and make it to the meeting, stuff like that.
Antidepressant medications are nothing that any self-respecting addict would enjoy. You couldn't give them away downtown. They have no euphoric effects. And for the most part, it's like an antibiotic. It's thinking, did I take that or not? The purpose of an antidepressant, and I do think an antibiotic is a good analogy, is to help build back up the natural chemicals in your body that are lacking because of the illness. And so therefore, it is a tool for recovery to take medication. That if I take my antidepressant medication, I have the energy to get myself to a 12-step meeting, get myself to my recovery support group, get to work, do my life, and get going. Antidepressants is sort of a jump start.
Some of us need medications for that jump start, and some of us don't. But medications won't solve all of our problems. We need other skills too. Learning to express how you feel is a big one. And if you're like me, you have a hard time telling people when you're angry or hurt or lonely. But when you don't talk about these things, you stay depressed.
Many people repress, meaning stuff down their feelings to where they're too overwhelmed and they can't talk about them. Talking about your feelings on a day-to-day basis is working the steps. It's using those tools in your recovery so that you're keeping a clean house as you go. So that if I'm angry at you, I talk about that anger now and don't let it build and blow into a big balloon that pops on me later and I end up relapsing behind it.
Me? I got no problem telling folks I'm angry. In fact, I'm known for hollering. For years, I used to blame my drinking and drugging on my wife, my kids, the boss. Everything was everybody else's fault. I was so busy criticizing others, drove a lot of people away. My own kids were scared of me. I got into this ugly pattern of criticizing them all the time. Always telling them what was wrong with them. It hurt them. It hurt me.
Related strategy, too, is to learn to share positive feelings with other people. Love, affection, caring, those sorts of things, because that helps build better relationships. And people with more satisfying relationships often feel better about themselves as a result.
All right, it looks like we've got two opposite problems going on. Lynn, you don't talk about what's bothering you. And Will, it sounds like you're too busy telling folks negative things. Let's try something. Will, why don't you think of some positive things you can tell your wife and your kids? And Lynn, you think of how you're going to tell someone you don't appreciate that they did you wrong.
Well, my wife, I can tell her I appreciate her cooking dinner every night this week. We used to go half and half, but I had a lot going on this week, and she picked up the slack without complaining.
And your kids?
I don't know, they're good kids. I guess I could just tell them that. Like I said, I don't let them know that I'm proud of them, but I am.
See, if you want good relationships, you got to tell people how you feel. And that means both ways. You let them know that you love them, and you let them know when they upset you. Lynn?
Well, I sent my ex-husband some paperwork from my social worker so that we can get our son on medical assistance. He was supposed to fill it out and send it back, but he hasn't done it yet. I mean, it's no big deal, but he always pulls this crap on me. I mean, if it were just me, it wouldn't matter. But when he gets our son in the middle of it, I get really, I don't know, depressed. I guess I shouldn't get bent out of shape. But
No, there's no should or shouldn't. The fact is you're angry with him, girl.
see, he would say that since I have custody, I shouldn't complain. I guess I don't have a right to be angry.
It isn't a matter of being right or wrong. You feel what you feel, and if you're feeling upset or frustrated with someone, you gotta let them know. You gotta talk about it.
I don't think it's wrong that you're mad. He's got no right messing with a kid's medical care.
I suppose not. I guess I should tell him it bothers me.
Sure
Yeah.
you can. And from there, you two can work out a solution, or at least you'll feel better. But nothing's gonna change if you don't tell them about it. See, learning to talk about your feelings is really important in dual recovery from depression and addiction. For some of us, it doesn't come easy. It's gonna take some practice. So start in small steps.
So if you're learning to express your feelings to other people, you don't start by sharing your feelings with your boss or a stranger or neighbor you're upset with. You start with a family member whom you know and trust and you're close with. You practice with them, and then the more comfortable you get with that person, then you'll be more willing and able to do that with other people. And like any other skill, it takes time, patience, and practice over and over, before you become comfortable. Any change is difficult at first.
People with depressive disorders get into what they call negative thinking. Our minds tend to hang on to negative thoughts. Nothing seems right. We exaggerate stuff till it seems much worse than it really is. We're not grateful for what we have, and we feel bad about the stuff we don't have. We get impatient and wonder why things aren't changing. That's negative thinking, and when we think that way, it only makes our depression worse. Now, here's some examples of negative thinking.
I'll never get caught up in my bill, so what's the use of working so hard?
I should have never gotten divorced. I'm going to end up a lonely old woman.
Why does everything bad happen to me?
I'm sick of being clean and sober. I'm not having any fun.
Well, everybody's getting their act together except me. There's something wrong with me.
Negative thinking is real common with people with depressive disorders, but we can learn to challenge negative thinking and turn it around.
I could sit here and tell you if my worldview was colored by the paint factory of depression, that all data in is colored black because of this mood disorder, then everything's bad. It's all the same. My job sucks. I hate my boss. I hate my husband. Nothing's better. Recovery doesn't work for me. Yet, if you're in a group of other people who are alert to the signs of depression as well as recovery, they'll say, wait a minute, you've got a promotion, you just said you just feel good about yourself because you're working out, blah, blah, blah. They can point out the depressive thinking and challenge that because people get used to thinking that the cup is half empty.
Now, this is how you challenge negative thinking. You look at these messages you're telling yourself, and you say, is that really true, or am I just exaggerating? Am I sitting here feeling sorry for myself? Am I expecting things to change without really working on them? And you got to practice challenging your thoughts.
Well, some of the negative things I tell myself are true. I'm not making them up.
Like what?
Like when I tell myself, hey, girl, you've blown every job you've had in the last 3 years. What makes you think you're not going to get fired from this one? That's not negative thinking. That's just the honest truth.
No, that's negative thinking. Now, the part about you being fired from your previous job is true, but that don't mean you're going to get fired from this one. Now, there's a reason you got fired before, right?
Yeah, because I was getting high on my breaks and not showing up on time.
Okay. So you made those mistakes in the past. Now, I'm guessing you learned from them. You know more now than you did then, right?
Yeah, I'm not using, I'm getting to work on time.
Okay. So stop telling yourself you're going to get fired. That's probably not true. When you make a mistake in the past, you got to learn from it so you don't make the same mistakes over and over. And you got to keep practicing how to think positive, and you don't set yourself up to fail. When you make a mistake, you learn from it, you forgive yourself, and you move on.
I see what you're saying. Like I could be telling myself, I'm going to be able to hold on to this job because I'm not using anymore.
That's right.
Oh.
Stay on the lookout for negative exaggeration. With a depressive disorder, chances are we don't believe in ourselves. We don't think we can make anything of our lives. This is a dangerous message, and it's a lie. When we tell ourselves, I'm not good, I can't do this, it's just an excuse to keep making the same mistakes. Instead, say, hey, I ain't perfect, but nobody else is either. I'm going to try to get a little better each day. And remember, you got to keep practice on how to think positive. And remind yourself, you're responsible for your own recovery. Building a new life can be slow and tough at times. So be patient with yourself.
Thinking about getting drunk or high can happen even if you haven't used for a long time. It happens to most people in recovery at some time or another. But you can't let it get any farther than the thinking stage. If we relapse and start to use again, then we're likely to relapse in our depression as well. The two are connected in that way. Using will make you depressed, and depression will make you want to use. So if you're thinking about using, talk about it.
Absence is vital because if you continue to drink alcohol or use drugs, you won't get over your psychiatric illness. Several things can happen. The symptoms can get worse, they can continue, they can get covered up temporarily, psychotherapy will be less effective, and drinking and drug use will interfere with the effectiveness of antidepressant medications depending on what you use. For example, alcohol can either elevate or lower the level of antidepressant in the blood, giving a false reading. And many patients who continue to drink and also have depressive illness just don't get better. So abstinence is extremely important. There's no compromising.
No compromising means there's no such thing as one hit or one drink. Once you start, we're back into it.
I can't tell you how many times I've been tempted to use. You know what finally made it easier for me to get through those times?
What?
Learning to turn my problems over to my higher power. See, when I have a problem I can't fix, I start feeling depressed and overwhelmed. For instance, last month, my youngest boy was diagnosed with fetal alcohol effects. That means he's got brain damage because I was drinking when I was pregnant with him. Now, here's a problem I can't change. And I was feeling so much shame and pain. I felt I couldn't do anything. I just wanted relief from the pain. I just wanted to get drunk and forget.
You started using?
No, I thought about using, but then I remembered my higher power. I prayed for some peace of mind. I prayed to my higher power to help me hold up under the pain, and I found peace. See, I let go. I turned it over, and I asked for help. I just said, hey, this one's too big for me. You gotta help. Tell me what to do so I don't start getting frantic and use again.
Did it work?
Yeah, I calmed down so I could use my head instead of using drugs. See, I prayed for help, and I got it. I found a counselor who works with drug-affected kids. I brought my son in and got an assessment. And they're teaching us both new ways to help him learn. See, your higher power is the spirit that guides you. But think of this higher power as a friend, someone who will always be there and loves you no matter what. You know, if you pray or meditate, your higher power will help you get through those moments you thought you'd never get through without using. You know, it's okay if you don't believe in a higher power to begin with. It's a relationship that develops over time, and when you're ready for it.
With the dual disorder of depression and addiction, we're not going to be able to recover by ourselves. So we need to stay connected to the professional team we're working with, our psychiatrist, counselor, or therapist. And that means keeping appointments, staying honest, and keeping the professionals updated on how we're doing overall. We also need the support of our families and our peers, other people recovering from addiction and depression.
I go to a 12-step group. My sponsor and I are very close. I don't know what I'd do without her. You need to know that there's someone you can call for help no matter the hour of the day or night.
I go to a depression support group. Those people have been through the same problems I have. They deal with the same issues. Man, I really respect what they got to say. I also need a recovery group that focuses on addiction. I used to go to AA, but they just didn't work for me. I found a better addiction recovery group that works good for me.
At first, I hated the idea of talking about my problems to a group of strangers, so I didn't go to group meetings. But my therapist convinced me to go. She said it wasn't enough just to be on medication, that I had to have other skills like learn how to open up and talk about my feelings. I thought I'd be judged and criticized, but it didn't turn out that way at all. I guess that's why they call it group, because it teaches me to trust.
Another important part of recovery is our families. I mean, a lot of us might have messed things up if we were violent or stole from them or messed things up in some other way. But family support is so important. We got to repair those relationships.
My mom and my brother stuck with me, but my Dad and my other brother won't have anything to do with me anymore.
Yeah. Well, a lot of us are in that situation. But after a while, see, the family will come around when they see we're serious about changing. Got to respect them, you know. Let them come around at their own pace. They'll see the change.
What changed it for my family was learning about the disorders I got. The more information and education they had about it, the more they were able to help me.
Well, family members can be involved in assessment. They can give important information to the treatment team about the dual diagnosis person's illnesses and their behaviors and the impact on the family. Secondly, if they're involved in treatment and recovery, they can help and support the dual diagnosis person's recovery, by giving encouragement, pointing out early warning signs of relapse and those sorts of things. But very importantly, their involvement allows them a chance to deal with any concerns or problems or reactions they have related to the dual diagnosis.
Recovering from depression and addiction means making changes. We can't expect our life to get any better if we don't work at it. There are some big changes that have to be made and small ones.
One of the biggest lifestyle changes I had to make was I had to quit hanging out with people that use alcohol or other drugs. And that was practically everyone I knew. But I'm starting to make some new friends with the folks I meet in recovery.
One of the changes I made was trying to get a little bit of exercise in every day. Simple things like going to the store or take a walk around the block, whatever. But it really helps with the depression.
I take a mood inventory. I keep track of all the little warning signs that tell me when I might be headed for relapse. Stuff like wanting to use, sleeping too much, too little, not eating, dwelling on my faults, feeling hopeless about the future, and not going to group.
What do you do when one of those things happen?
I keep a list of phone numbers on me at all times so that I can call someone whenever I feel like I'm going down again.
Another thing is stay busy. If I'm sitting around home all day with nothing to do, I know I'm going to start worrying about how hopeless or bored I am. I know I'm going to want to get drunk or high. I schedule out each day so I'm not sitting around with time on my hands. I got to stay involved in something outside of myself. Getting a diagnosis for depression means you can get the help you've probably needed for a long time. Now that you know what's wrong with you, you can get about the business of fixing it and just take it one step at a time.
The more I know about my two disorders, the better decisions I can make. Educate yourself, ask questions, find out everything you can. The more active you are in your recovery, the easier it goes. And remember, there's an awful lot of us out there. You are not alone.
When depression starts making me feel like I can't get anything done and life's just too hard, I say, hey, that's the disease talking to you. That's not reality. I mean, yeah, I've got two disorders, and that's tough. But then again, I've made the first steps, and I've got much too much going for me to give in. I've got a lot to be grateful for. We all do if we stop and think about it. So keep your thoughts positive. It gets better from here. Best of luck to you.